Colleagues, I am pleased to introduce House Bill 2024 to you. As you know, oral health care is incredibly important in terms of keeping health care costs down, reaching our 40-40-20 goals, whole variety of concerns that we have for Oregon's children and adults, in fact. There's a report that was put out, the Strategic Plan for Oral Health in Oregon, 2014 to 2020, that has a lot of recommendations in it, and the City Club of Portland also had a task force that made many recommendations. And this bill comes out of some of the recommendations presented by those two committees. In this report, the statewide report, it says 58% of third graders in Oregon have experienced tooth decay. And one of the problems is a lack of workforce able to handle this challenge. 24% of Oregonians live in federally designated dental health professional shortage areas. In 2013, the U.S. Department of Health and Human Services ranked Oregon as the 10th worst state for dental shortages. Meanwhile, Oregon's recent healthcare transformation and the integration of dental plans under CCOs create an increased demand for dentists who accept Medicaid-eligible patients. Workforce shortage of trained providers is fundamental to the lack of access to dental care in Oregon. The shortage has two primary elements. Dentists are unevenly distributed, and some regions of the state have inadequate workforce to serve community members, and too few dentists and medical providers accept Medicaid patients for a variety of reasons. HB 2024 would direct Oregon Health Authority, in consultation with CCOs and dental care organizations, to certify and train certain healthcare workers to provide basic preventative dental services to underserved children, and to connect them to dental homes, and to do an initial assessment. That's not a screening that's done by dental hygienists and dentists, but just an assessment, a very basic risk assessment. It also directs Oregon Health Authority to reimburse the cost of preventative dental services. Fundamentally, the concept of this bill came from the City Club Children's Dental Health Task Force out of many interviews and community and stakeholder groups that we had prior to the session and during the session. It passed unanimously out of the Health Committee, and I urge you to join me in voting aye. Thank you.